In this video, I'm going to go over the different types of symptoms of PTSD and what treatments are the most helpful for the different symptom clusters and for the disorder overall. Hello, I'm Dr. Claire D'Adelsina. I'm a Stanford-educated clinical psychologist and business owner. I am a trauma expert and I've helped thousands of people in private practice and in different settings heal their trauma. And I am here to give you some information so that you can be more informed when you are out there looking for healing and help for yourself. So in my last video, I talked about what the diagnostic criteria for PTSD is and the different types of symptoms. So if that's something that you feel like you need some understanding of, I would go back and watch that video first. I will put a link to that in the description of this video. So one important thing is that your symptoms are actually giving you a clue as to what you need help with. And that might sound obvious, but I think sometimes people are struggling with different types of symptoms that are coming up. And those symptoms can really guide you and tell you what therapy might be most impactful. And I feel like this is something that I've come to understand as a clinician, but I don't think it's readily understood by patients and clients coming in. And so I want to break that down for you a little bit. If you are someone who is struggling, you've tried a bunch of therapy, maybe it hasn't worked or it hasn't worked as well as you would have hoped. This will help you know which direction you might go in to help you the most right now. So the first question I would ask you is, how does your trauma show up for you now? What are the symptoms that you are noticing right now currently that will help you the most in understanding which direction to go in? So again, the last video that I did is all about the different symptoms and symptom clusters. So if you're unsure, you know you're struggling with PTSD or traumatic reactions, but you are unsure what those symptoms are, that's a good place to look at and to start. Maybe you know exactly. Maybe you're like, it's nightmares, it's extreme panic and anxiety, it's anger, it's avoidance. I can't even go to certain places or talk to certain people. Those are all different types of symptoms and can be helpful to understand what are you struggling most with right now. All right, so one way to also take a look at your different symptoms is the PTSD Symptom Checklist. I will also put a link to this assessment in the description of this video. It's not meant to be diagnostic, meaning that you don't hit a certain number and you certainly have PTSD or you don't. It's simply to help better understand symptoms. This is a really good place for you to get more information for yourself if that is something that you would like. So the first 5 questions on the PCL are really about re-experiencing symptoms. So re-experiencing symptoms are repeated distressing memories or thoughts or images of a situation, of a trauma, dreams that continue to come up from a trauma. It can be the exact kind of reenactment of the traumas. Often it has little pieces of it. Suddenly acting or feeling as if it were happening again, like you were reliving it. So this is essentially like a flashback. Feeling very upset when something reminds you of a stressful experience from the past, and having physical reactions when something reminds you of the past. I talked about this in the last video, but I really believe that re-experiencing symptoms are a big differentiator in terms of what makes PTSD unique from other anxiety disorders. The past is truly living out in the present. So flashbacks aren't happening the way that we see them in the movies typically. It's not that you're going to see a scene play out in front of your eyes. It's typically that something in the environment or internally reminds you of the past, and the emotions that you would have experienced in the moment or sometimes did experience come flooding back. So you're feeling an intense amount of rage or horror or panic, and that can be an emotional flashback. Often people are in the process of remembering what happened to them as well. And so these experiences can really be the first time that people are feeling and processing events from the past. Can feel very confusing for people. I would say that if you're in a process of experiencing these types of re-experiencing symptoms, it's an extremely painful place to be. I understand, and I would just say that therapy is super important for you right now, because the reason that these things come up is that it is indicating that there's unprocessed trauma, meaning that what happened to you in the past hasn't been integrated into your body, your brain, your spirit, your nervous system, and it will continue to pop up if you don't do the work to process it. And when you have these triggers in the environment and you're having flashbacks or other re-experiencing symptoms, it's your brain and body's way of trying to heal itself, as painful as that feels and as wild as that is. That it is your body saying, hey, this is something that is still a wound. We need to attend to it. We need to treat it. If you don't do that within the context of some type of therapeutic setting, it will continue to pop up unannounced and at random because of what is going on in your environment. You can try to avoid more and more things, but it is a losing battle, and you will need more and more things to avoid that trauma and that the memory of the trauma, the things related to the trauma. Our brain is amazing at pairing things. So the type of environment you were in when this happened, it can kind of keep branching out. So let's say your trauma was an assault. Aspects of that person who did this to you, maybe it started with, okay, I feel uneasy around certain types of men. Okay, now I feel uneasy around men that wear hats, around men at night. Like, it can kind of keep branching out the more that you avoid, and you have to avoid more and more in order to have a false sense of safety. So, re-experiencing symptoms indicate unprocessed trauma. If you've gone through a lot of trauma, you may continue to have dreams here and there or things that come up. But when you're really in the throes of re-experiencing, it can be very all-consuming and it can feel extremely overwhelming. So just knowing that, I think, is helpful. You're not going crazy. You are not losing your mind. Your body and your brain is trying to heal itself. And if you don't do it in therapy, it's going to continue to come up in other places. So treatments that help. There are treatments that are specifically designed to help you process trauma. EMDR, eye movement desensitization and reprocessing, is a type of therapy that helps you bring up triggers in the present, and it helps you go back to what it's related to in the past to then reprocess it and to lay it down in a way that will not be traumatizing in the same way. That you'll be able to bring in your adult self, your current self, to help process and reintegrate those memories. Psychedelic therapy is a beautiful option now for trauma. Psilocybin therapy is available in Oregon and Colorado now. And MDMA will hopefully be legal for treating trauma in a therapeutic setting sometime soon. Ayahuasca. These options, while they can feel very scary for some people because there is a sense of letting go of control, they can really do an amazing job at bringing up what you have been trying to tightly hold and control so that you are able to have a new relationship with it, process it, and make big leaps and bounds around it. One reason why psychedelic therapy helps is that we can't fully treat trauma with just our intellectual brain. It is something that needs to be treated through the mind, body, and spirit. That is something that I did not understand when I was first in graduate school, and something I did not understand when I was first experiencing the re-experiencing symptoms that I had. Psychedelic therapy allows you to dive into something with your body and spirit and forces your mind to step aside in a way that really helps you dive into what has been painful in an extremely helpful way. It's not a panacea. It is not a cure-all. It's not like, okay, just go have this one experience and it's done. It gives you the recipe and then you have to follow it. It tells you, all right, this is what the next step is. And you still have to do the work around it. But it is extremely helpful option that we are really lucky to have some regulated legal options around. I will also say, in terms of psilocybin therapy being offered legally now in several states, there is a lot more safety in that process. There's people that have been working in the underground who are amazing. But I will just say that to be able to go to a website, to be an active consumer, to be able to really choose a place that you feel safe in, that they will go through a full assessment, they will really help you figure out if that's a good option for you or if there's any issues that would keep you from being a good candidate. So there's just a lot more safety around that process now because of having more legal options. Prolonged exposure is also a type of treatment option. This is not something that, oh, there goes the mailman. This is not something that I would necessarily recommend as a treatment to seek out, just because I feel like prolonged exposure is a really, and an ambulance, or a fire truck. Prolonged exposure is a really intense treatment option for trauma. It is super helpful for anxiety disorders generally, and exposure therapy is something that is helpful. Exposure therapy is essentially facing the things that you're avoiding and helping you resource yourself and get new coping skills so that you're able to approach things and you're able to manage that anxiety and you're able to approach more and more. Really helpful in pushing past avoidance. But I will say exposure is going to be a part of any type of therapy for trauma. So it's going to be baked in, because simply talking about your trauma is an exposure therapy. The very standardized treatment of exposure therapy is quite intense, and it's not something that a lot of people do in private practice. It's something you're going to see more at the VA and other places like that. Establishing safety is essential before trauma processing. This means if you go into a therapist's office and you know that you need to process your trauma, you will need to establish a relationship with that provider and feel very safe and feel like I trust this person and I can do this work with this person, because it is some of the most difficult and vulnerable work. And it's just really important that you trust your gut, that you feel like, okay, this is someone that A, knows what they're doing, B, I feel like I really, really vibe with, I feel like I trust, I feel like they are going to be there with me in a way that makes me feel very safe and secure. That's so important. It's also a timing thing that, you need to have some of that, and a therapist who understands when they need to push you a little, because you're naturally going to maybe want to avoid this stuff. That's part of PTSD. So push you to do the work and not allow you to avoid, but at the same time, understand that pacing of really establishing safety and trust. All right, so the PCL questions for avoidance, which is the next symptom cluster of PTSD, are avoiding memories, thoughts, or feelings related to the stressful event. So those are internal things, or avoiding external reminders of the stressful event. So if we want to treat avoidance symptoms, we're really thinking about approaching trauma. So in order to work through avoidance, we have to approach. That is a rule of any type of anxiety therapy, and really a key to living the life that you want to live, because the more that you avoid, the smaller your life gets, and the more that you find the courage and the coping and the resources to start approaching, the bigger your life can be. And I just want to say that it is worth the hard work to have a life where you don't feel like you are hiding and avoiding, because just doing that work in and of itself, when you're avoiding, you're kind of thinking about something. Like, even if it's not conscious all the time, there is a sense of, I'm avoiding this and I can't look over here. So in order to avoid this, I have to keep my eyes over here. It's not living in this full open way that is really the goal here. So treatments that help, any talk therapy or processing trauma is going to be a form of approaching. Narrative therapy, like writing a trauma narrative, is a way that you will actually touch your trauma and really look at it. Cognitive processing therapy is a type of cognitive behavioral therapy that really looks at the beliefs that have come from trauma and how they might keep you stuck. And prolonged exposure, which I just talked about, which would also be a way to fully treat avoidance symptoms. Integrating it into your life, talking about it with friends and family. engaging safely with trauma-related topics. This, I feel like, is an important piece because therapy is one part of this, but another is that this is something that's part of your life and something that happened to you. It doesn't mean you need to lead with it or talk about it all the time, but it is a nice part of your life to be able to talk with friends and family and to be able to not avoid it in those discussions and to be able to approach it in a safe way with people who you love and who love you. Oh, I'm going to move this a little. Okay, so changes in cognition and mood. So this is another symptom cluster of PTSD, which basically just means changes in how you're thinking and how you're feeling. This overlaps a lot with depression, trouble remembering parts of a stressful experience, having strong negative beliefs about yourself, the world, or other people. So beliefs like, I am bad, something's wrong with me, I'm broken, the world is dangerous. Blaming yourself or someone else for what happened. Having strong negative feelings such as fear, horror, guilt, shame. Loss of interest in activities you used to enjoy. Feeling distant or cut off from other people. Trouble experiencing positive feelings. So one thing with changes in cognition and mood is when you have been dissociated frequently, there's a numbness, that distant or cut off feeling. You can be very distant and cut off from yourself, from other people, and that's part of your brain and body's way of coping. But when you're cut off from the negative feelings, you also cut off from the positive ones as well. So it's almost like living in a fog behind a pane of glass, underwater. Like it's almost like this disconnect from the highs and the lows. And that is something to be thankful for in a way because it's protective, but over time, it's something that we want to think about working on so that you can experience life at its fullest, the good, the bad, and everything in between. So treating changes in cognition and mood, so changing beliefs that came from trauma is imperative. This is the bread and butter of the work that I do and that I love to do because it is so impactful in people's lives. I have been thrilled and astounded again and again of how this piece changes people's lives. It's just the most beautiful part of the work in that people can have beliefs about themselves that come from trauma. Things like, I'm broken, I'm doomed, I'm damaged. And sometimes they're aware of them and sometimes they're not. But when those beliefs are guiding someone's life, the reactions that come, the behaviors and interactions that come from those beliefs reinforce those beliefs. If you feel like, if I have the belief I am broken and I interact with the world from that belief, I show up in romantic relationships with that belief, I engage in the world with this underlying belief, I'm coming at it from a place where I may be picking partners who are also really struggling with something or who treat me a certain way. And then when I have a string of partners who treat me poorly, I then say, see, I am broken. Look at how everybody treats me. They treat me like I'm broken. When really the belief is the thing that's guiding you into those relationships, not your inherent brokenness. And helping people see that and change that changes people's lives, and it can change your life. Sorry, my recording just paused. But it can change people's lives and change your life in the sense that if you acknowledge and then change the belief, and then you approach the world from I am whole and I am good and I deserve goodness, you interact in a different way and then you get different feedback. So cognitive behavioral therapy and someone who's skilled in working with beliefs and thoughts is really going to be helpful here. Relationship in therapy is a really, really important piece, but having someone who's skilled in cognitive behavioral therapy or cognitive processing therapy, anything cognitive, is going to really help in working on these beliefs. Okay, treatments that help: cognitive therapy, cognitive behavioral therapy, cognitive processing therapy, narrative therapy. So when you write a narrative of your trauma, you typically see a lot of the beliefs come up. There's different exercises where you can be encouraged to write a narrative about your a narrative about your trauma, and different prompts around how that informed what you believe about yourself in the world. And those can be really, really helpful in understanding what your beliefs are, so then you can then change them. All right, so the last questions on the PCL are about hypervigilance. So irritable behavior, angry outbursts, acting aggressively, taking a lot of risks, being super alert, watchful, or on guard. So like scanning, checking, looking at the door. I used to work with the veterans who, if they went to, a football game or a basketball game, they're checking every exit. They're kind of scanning the perimeter all the time. Jumpy or easily startled. That is something that I'm still getting a lot of feedback from my husband about. Difficulty concentrating or falling and staying asleep. So this is basically the nervous system somatic reaction to what happened to you is still very much living inside of your body and hasn't calmed down enough for you to feel like you are actually safe. So treating these symptoms, so hyperarousal is due to a hijacked nervous system. You're still living in that place of, maybe if you grew up in a chaotic or violent or traumatic household, you were on guard and you're still feeling that way. Treatments that help: somatic therapy, therapists that actually specialize in doing somatic work, and somatic experiencing is one type of therapy that Peter Levine created and is really helpful in terms of managing your body's symptoms. Internal family systems is a way to actually see how the different parts of you are still on guard and how to help calm those pieces down. Yoga, mindfulness, and meditation are game changers in terms of helping your nervous system calm down. It is really, there's a lot of evidence now about how much yoga and mindfulness, as you all probably know, help with mental health in general, help with our happiness in general, but certainly if you're someone who has experienced trauma and you're struggling here, yoga, mindfulness, meditation are things that are going to be game changers for you. I know it can be hard to get started because it's counter to what you want to do, which is be on guard, but just start really, really small. Start with a minute a day. Start with doing 10 minutes of yoga from a YouTube video before you hop into like a 60-minute class, if that's helpful for you. Figure out how to do it safely and just know that it's the consistency over time that is going to really be the game changer. It's not going to help you to try to do it one time. And it's definitely not going to help if you're feeling really triggered and you're like, all right, what do I do to calm down? I'm going to like meditate right now or do yoga right now. It has to be something that you do when you're not feeling triggered, so that when you are feeling triggered, it's something you can count on. But it's really more about building that baseline, consistent effort so that you have a foundation of calm and a foundation of no longer being hijacked. Mindful activities in sports, anything that really gets your body moving and you feel like you can just be in your body and feel strong, feel meditative. Those are all really powerful things. Psychedelic therapy is also going to help heal your body. So in thinking about trauma impacting your life, if you look at the PCL number overall, that will give you an idea, and also just seeing which symptom cluster might be the highest for you, what treatments have helped or not in the past, and where you might still be stuck. All of these symptoms work together. It's kind of like a band with different instruments, and they're all together playing a song. They all keep the disorder running. Avoidance is really the engine that keeps things running, because the more that you avoid, the more the other symptoms are going to pop up. So I'm not saying that, oh, you're only going to have one symptom cluster and you should go just only pay attention to that one thing. I am saying, however, though, the reaction to trauma and PTSD in general, there's going to be ebbs and flows to what's bothering you at different times. And there's going to be things where you might need something different at a different moment. At one moment, you might simply need a relationship with a therapist where you feel like you establish safety and trust, and that you can do processing down the road. You might need to establish a relationship with a therapist and start working on your mood and your beliefs before you can do the processing. Or you might feel like you are so in the throes of re-experiencing that what you really need to do is focus on processing so that you're not just sitting and suffering in a constant chaotic feeling of living in the past. So really just understanding where you are at now and how to seek these different people out and different types of therapies out. You can go on Psychology Today, and actually that's a website, a directory for therapists, and look up different people's specialties. Look for people who specialize in trauma, and look for people who might have experience with these different types of therapies so that you can get the help that you're looking for. All right, I really hope that this has been helpful and that it gives you some guidance as to where to go next. And I hope to see you again next week.